My name is Abdul Razak. I am a senior scribing trainer with over 18 years of experience in the healthcare documentation industry. Today we are going to try to answer questions most people have about scribing. But before we get into that, if you are a bioscience background fresher or a medical transcriptionist who wishes to know more about the scribing industry, explained in simple terms, you have come to the right place. The first question most people ask me about scribing is, what is the difference between offline and online scribing? Is there something called online scribing and offline scribing?
In online scribing, the scribe is working live with the provider. The notes are uploaded by the time the patient leaves the examination room. The notes are ready for the provider anytime during the shift. The scribe can ask the provider to clarify any questions or doubts, and the providers usually respond immediately. In offline scribing, the patient-provider interaction is recorded. The scribe listens to the recording and gathers information from the conversation and types the information in the EHR. Here, the scribe does not have the option of asking any clarifying questions to the provider. However, the scribe can listen to the conversation multiple times if there are any doubts.
The next question is, how do scribes communicate with their doctors? Is the scribe allowed to ask any questions to their doctors? If yes, how?
There are two different methods of communication with the provider. Messaging. The scribe messages the provider any questions or doubts he or she has. The provider reads the message and responds to the scribe. Talking. The scribe speaks with the provider directly through a platform which allows voice calling. The provider and scribe can interact through the platform.
If a scribe is allowed to ask questions to a doctor, will the doctor get angry if a scribe asks the provider any questions?
Yes, a scribe is allowed to ask providers any questions or doubts. However, the scribe should not disturb the provider when the provider is interacting or examining the patients. The scribe should wait till the visit is over and the provider is outside the examination room to ask any questions. Providers usually allow scribes some time after visits for questions or doubts.
Most people are of the opinion that scribes work with their doctors continuously without taking a break. They also ask this question, how does a scribe take a break? Will a scribe get lunch break or restroom breaks?
Yes, a scribe does get breaks during the shift for lunch, restroom breaks, etc. However, the timings may not be fixed. Scribes usually follow the provider's schedule. Scribes usually take breaks when the providers take break. Most providers usually allow scribes to take break for lunch. Providers also allow scribes to take quick restroom breaks. For example, a provider has just seen a patient and another patient is waiting. The scribe can inform the provider and take a quick break.
These are some of the most common questions most people have about scribing. If you have any more questions about scribing, please write them in the comment section below and we will try to answer any questions that you have. If you like the content of my videos, please subscribe to my channel and share this video with your friends, and also press the notification bell so that you get notification about my upcoming videos. Thank you. Until the next video. Bye. Take care.